My name is Shirlene Chase. I'm a nurse practitioner, and I work with Dr. Eric Liu in Nashville, Tennessee. And I'm going to talk about today the role of a nurse practitioner in working with neuroendocrine patients to help both patients and families to understand what I do, and also for the physicians here to see how a nurse practitioner may enhance the care that you provide to patients with neuroendocrine tumors. So I have a real interesting position with the team. For the most part, I find I'm a coordinator of care. You might say, if we were talking about hockey, I think sometimes I'm a goalie. And if you think about football, I'd probably be the safety. I work in a university teaching hospital. I work with surgical oncologists. I work with 4 surgeons. And I work mainly in the outpatient arena, taking care of patients with not only neuroendocrine tumors, but other GI tumors. And I also have a nurse practitioner that is my counterpart on the inpatient side. So we work collaboratively together to provide care across the whole continuum. And then I want to tell you a little bit about Nashville because I think it'll help you understand the population that I work with. Nashville, Tennessee, if you don't know, is in the southeast. It's mainly a community, a rural community. And there's a lot of country music that goes on in Nashville. I don't know if any of you are country music fans. But we have a lot of our patients are from Nashville proper, but they're also outside of Nashville. So contrary to my family, I'm originally from California, and so they're constantly asked, did you see any country stars today? So, occasionally we will, but they're not like just flooded in the university. And many of you may not know, but we recently had a flood in Nashville. Usually it doesn't flood there. We had a huge flood, and many of our Vanderbilt community faculty, staff were affected, as well as many of our patients were affected. So if you didn't hear about it, it was literally like the picture on the bottom there of houses floating in the middle of bodies of water, cars floating down the road. So that's kind of what's impacted us lately. Vanderbilt University Medical Center gets referrals from all over the country, internationally. We have a nationally recognized cancer center, the Vanderbilt Ingram Cancer Center. And that's where my clinic is and where the surgical oncologists that I work with are. So in the clinic where I work, there are nurses that work with the different surgical oncologists. And I see patients, not only my own clinic, where many of the neuroendocrine patients are referred for long-term follow-up as well as for surveillance. But one of the things that happens is, as many of you have heard from the conference so far, there's a lot of information. And new patients that come to Vanderbilt, I'm in the room, usually the patient and the patient's family's in the room, the doctor, and usually the clinic nurse is in there. And for an hour, the patient is given a lot of information, they're examined, and then, decisions are, planned out, and then all of a sudden the doctor leaves the room, and I get this really puzzling look from the patient and their family, and it's like, what just happened here? I think I'm supposed to do something, I'm going somewhere, there's things that are going to happen, but I don't even know where to start. So that's where a lot of my translation comes in. I spend a lot of time getting to know the patient and their family, what brought them to this point. We find most patients get to the point of being referred to Vanderbilt after many months and sometimes years of going to a variety of doctors, having a variety of tests, and then finally, after they've gone through all of that, then they find out what diagnosis they have, and they're not really sure where to turn or where to go for information, because when they tell their other family and friends that they have a tumor on their pancreas, they get that look. Yeah, you better go to Vanderbilt because you're not going to be alive very much longer because you have that tumor on your pancreas. So there's a lot of education that has to be done. I spend a lot of time in walking them through, not giving them all the information all at once, but working with them over time to help them understand a little bit more about what's going on, where their resources are, and going from there. Let me tell you a little bit about how I fit within the organization at Vanderbilt regarding nurse practitioners, because some of you may have seen nurse practitioners maybe when you've gone to your primary doctor, but nurse practitioners in specialty practice is ever evolving. At Vanderbilt, there are over 450 nurse practitioners that work throughout the organization. And many of you are familiar with family nurse practitioners, and we have many nurse practitioners that work in acute care in the hospital. But more and more nurse practitioners are gravitating to specialty practices. And like myself, I've got over 25 years in healthcare, and all of my experience sort of led me to this point. About 12 years ago, I was working with a gastroenterologist in his practice, and I cared for quite a few patients who had carcinoid tumors, and all I knew about carcinoid was my conversation with the gastroenterologist. These are benign tumors, and basically, you're treating their symptoms. So I spent a lot of time in understanding what symptoms they were having, and I've gotten sort of an expertise in managing some of the complications and symptoms of patients who either have carcinoid or other neuroendocrine tumors. You've heard a lot about team approach, and as you've heard, team approach is also the way we do it at Vanderbilt. But I'm asked questions like, who's the leader, to organize the care and all of that. And what I find is it doesn't matter who you get referred to at Vanderbilt. So in other words, if you get referred to a medical oncologist or you get sent first to a radiation oncologist, what happens is those experts that work with patients with neuroendocrine tumors, they collectively bring those cases to the tumor board where we discuss all of that, and their care is discussed across the continuum. And similarly to one of the speakers had talked about, ensuring that there's a consensus that's reached. And so that's how, our care of patients with neuroendocrine tumors happens. So each individual will bring that, and then they'll make decisions about, should this patient, be considered for surgery? Is this something? And so then perhaps the surgical oncologist, Dr. Liu, or the other ones that I work with, might see somebody and do that process of evaluation first. So that's how our team works, very coordinated. Everybody's on board with knowing, what needs to happen next, and trying to help get patients to the next level of care or the next provider that's going to see them and evaluate them. So a lot of you have heard a lot about what neuroendocrine tumors are, the breakdown of what tumor markers are being watched and all of that. But one of the things that I think that I want you to understand about my role in working with a diverse amount of patients with endocrine tumors is the quality of life issue becomes what I get very much involved in. Explaining what neuroendocrine tumors are, a lot of the education piece I can bring in, and the clinic nurses also can help participate in explaining that. But in looking at the quality of life issues, that's how I get involved. That's where I spend a lot of my time. You know, I am involved in following a lot of the patients, watching the tumor markers, looking at the scans, reviewing them with the physicians, and planning the next level of care. But the quality of life issues come up time and again, and those are the calls that I get a lot of. Those are the calls where I have patients calling back and asking things that are affecting their daily lives. Communication is another area where I spend a lot of time. Communicating with patients and families when they come newly diagnosed to Vanderbilt, but also with patients that are ongoing and are 1 year, 3 year, 5 years out. Those patients we follow too. I work a lot with healthcare providers and educating them about what's going on, about what we do in surgical oncology. So not everybody that I work with, there's really no one else in surgical oncology as far as a nurse practitioner that I can go to ask questions and that type of thing. So I serve as a resource for a lot of the other nurse practitioners that are caring for patients in different ways that are affected. I do a lot of one-on-one education with patients and their families. I have a lot of community conversations with advanced practice nurses out in the community that are doing primary care, but also in general nurse practitioners that are working in a variety of settings to help bring this to their level of attention. Attending conferences like this one, the opportunity to speak with patients and families about what's going on, and other provider groups. I spend a lot of time with that too. So as I talked a little bit about, patients are usually referred, they may see the surgeon, they may see a medical oncologist, and a lot of the information that you've received over these last couple of days and the information that you've received over time, it can be a little inundating, and a lot of resources are needed for patients to turn to. And here in Canada, you have, seen that, but we have caring for carcinoid disorders in the Americas, and I'm not fully up on what they're doing, other than I have some of their brochures of the information that's out there. But this is a fairly new organization and the education that they're putting out. So I'm looking forward, after getting motivated by all of you, getting more involved and hopefully bringing it more to the top of people's list. I want to get to a few questions that I've had just as I've been talking with everyone here at the conference. And a lot of people have asked me questions like, why are we not having more conversations about neuroendocrine tumor so that we can get more research money? And why don't we have people out in the media talking about it? And one of the things that I do want to give you food for thought on this is that, number one, we do have people that are in the media that suffer from neuroendocrine tumors and diseases. It's not really something that people want to go out and talk about, is what we've found. For instance, if you put yourself out there and let people know that you have a carcinoid or some other neuroendocrine tumor, what's the first thing people are going to ask you? Well, what symptoms do I need to be aware of? And guess what? People don't like to talk about diarrhea in public. People don't like to talk about the GI symptoms that you have when you have a carcinoid. So the visibility of it shuts people down. And so I just challenge all of you that, in order to get out there, the people, your representatives and all of that, they don't want to hear from the providers because that's pushing our own agenda and that. But patients who suffer from neuroendocrine tumors and all of the problems and associated symptoms that go along with that, that's what makes, a difference. I was relating it to, they said, well, Katie Couric got out there and was talking about the colonoscopy and preventing colon cancer. And I said, yep, but she never said one word about diarrhea. So, you have to get out there and be aware that people are going to, that's the first thing they're going to ask is what do I need to be aware of and what are the symptoms. So you need to talk to people in your communities, you need to talk to your representatives, because right now it's not visible. You have to make it visible. And like, for instance, with breast cancer, which is, big on a lot of people's mind, but it wasn't until someone spoke out and said, I have breast cancer, and the next thing you knew, it was your sister, it was your mother, it was your cousin, it was someone who you could put a face on. And so many of you are going to have to step up, and you're going to have to let people know that you're a mother, you're a sister, you're a brother, you're an uncle, and this is a disease that warrants the attention and the research. And until we kind of get the money into the research so we can do some of these studies, there's going to be a disparate, you saw some of the scans that Dr. Liu was showing you earlier today, and some of those scans we don't have here, and part of the reason is we don't have the research money to go into it to run those. So we're working, each of us are working in our own way to make a difference. And I just wanted to take this short time and talk to you a little bit about my role, and I certainly will welcome any questions that you have or any comments about my role. Thank you.